Those working at our prisons are among Ohio's frontline heroes. We thank them very, very much for their work. Very sad to report that COVID-19 has taken the life of another member of the Ohio Department of Rehabilitation and Corrections family. Bernard Atta had been a nurse at the Correctional Reception Center in Orient since December of 2012. He'd been off work since May 8th after showing symptoms of COVID-19. He subsequently tested positive. He was just 61 years old. He died at his home yesterday morning. Our condolences go out to his family and to his colleagues. I've asked DRC Director Annette Chambers-Smith to join us today to give us kind of an update. She did this several weeks ago, but to discuss the latest measures underway in our prisons and how things are going. Director, thank you for joining us.
Good afternoon.
You want to just kind of... Go ahead, Director.
We did have another staff person pass away, as you mentioned, and Nurse Bernard Atta will be missed by his family and his correctional family, but also by the patients that he faithfully treated and served. He was one of 12,000 staff that come to work every day, even though they know there's COVID all over the prison, and they do their job and they take care of the people that are there, and they care. We've had 3 staff members pass away from COVID, as well as 61 incarcerated adults. And we feel every single one of those. We work every day to try to not have another. This is a vicious disease, and not everyone is making it through. We don't work alone. We get help from specialists, from environmental health specialists to epidemiologists, infectious disease specialists, physicians, hospitalists, all to try to do the very best we can for our patients. We follow the CDC guidelines for prisons and have them implemented everywhere, and we QA those to make sure that we have quality assurance and that things are happening everywhere. We have 2,100 fewer people living in our system than we did when this started, or as of March 24th, and that helps us spread people apart farther. As you mentioned, social distancing is one of the very important things in terms of trying to control the spread of this disease, and that's the one luxury that we really don't have in the Department of Rehabilitation and Correction. We have more space, but we don't have huge amounts of space. We did start testing our patients early on with signs and symptoms, as was recommended by the health department at the time. And those recommendations have evolved over time with availability of testing and with additional science. The next evolution we took was to mass test, and we did that at 3 facilities. We thought we would find asymptomatic people, a 20%, maybe 30%, that we could move elsewhere and sort of quarantine off so that everyone else could be safe. But we found that testing is really just a point in time. It doesn't really tell you about people who have incubated and they don't have enough viral load to make a positive. And it doesn't really help you if you find out that 96% of your positive people are asymptomatic and positive, rather than the 20 to 30% you thought you were going to find. So once we really found that kind of spread, something that Dr. Acton said and taught us early on is certainly happening inside the prisons. And that is, she said repeatedly early on, we may get to a point where community spread is so vast that testing is no longer recommended. And while thankfully we did not get into that situation in the state of Ohio, we have gotten into that situation in the Department of Rehabilitation and Correction. So armed with all this knowledge, what should we be doing? Well, we should be treating people, and that's what we're doing. We're looking for signs and symptoms. We're treating people. We have a new testing plan that we're following, and it's based upon, interacting with the experts as well as utilizing the science of what we found going on inside prisons, because we were the first people to mass test. We're the first people to get results back, and now we're going to be the first people to evolve, because we need to do things that help us take action to help people and save people. We are using this new testing plan at Belmont Correctional Institution. I think over 200 people have been tested there already. Some of the elements of this new testing plan involve testing people on the way into our system and then quarantining them for 14 days and not allowing them to really leave reception for 35 days. This process has revealed a female that was received at the Ohio Reformatory for Women Reception Center, and she was tested positive upon entry. And so therefore, we're now testing the people that she lived with to make sure that it hasn't spread to them. Now we have to wait an appropriate number of days so that we're not testing so soon after her arrival that it didn't have time to incubate and grow in someone else's system. Once that time period has passed, we will be testing them, and they're in quarantine now. The medical director can order whatever testing he thinks is appropriate. So he orders testing for signs and symptoms, yes, but he will order testing for other reasons as well. And he bases those on things like the physical plant of the prison, the health and age of the people living in the prison, and different items like that. So he may test an entire unit. He may test people in a unit. He may get enough testing to determine that he thinks it's pretty much spread everywhere, and then he would cease testing and just begin treating. So it's based upon his clinical decision making. We also test people pre-surgery, and we test people on the way out. If you are leaving early, we will keep retesting you until you're negative, and then you'll leave. And if you're leaving on time, we would test you and keep you quarantined after testing. And then if you are positive, we would give you a letter that's based on information from Dr. Acton's order that would allow the community and local health department to work with you and make sure you're quarantined the proper amount of time before you begin to mix with other people. I say all that to say that we are testing when it is actionable, testing when it helps someone, testing when someone can be either quarantined safely away, not put in contact with someone else, or when it's their health care is going to be impacted. So that's kind of how our testing system works. We also screen our population. So at a place like Belmont Correctional Institution where there are positive people, we would screen every single inmate there for symptomology and temperature, and also we would use a pulse oximeter to make sure that they still have adequate oxygen saturation. At this point, we've tested about 17% of our entire population in the department, and we continue to test wherever we think it's clinically appropriate or where we can impact things. The next evolution we're going to be making is to utilize antibody testing, and we've already done that at least 3 facilities, and that helps us further understand what's going on in a prison. The totality of this helps us make sure that we can operate as safely as possible for our staff and for our inmates. Marion was our hotspot at one point, and they've come out the other side. They have like 1,600 people that have recovered, and that's great. That's what we like to see. That's obviously the goal. But our hotspot now is Belmont Correctional Institution. So we've done some things like surge in the National Guard. We've put SRT members and STAR members in there from other prisons. We also are utilizing the Highway Patrol to make sure that we can staff while the people who work there that are ill have time to recover. We are using multiple hospitals, multiple ambulance contracts. We've brought in, things like oxygen concentrators and mobile showers so that we can use non-traditional housing and segregate people that are ill or put them in places where the staff can easily care for them. This is not easy, what we're doing, and the people at Belmont Correctional Institution they're a team, and they're really doing great work. I know there's a lot of COVID there now, but for weeks that facility was able to keep it to just 1 unit. And that may not sound like much, but when you're talking about COVID, and as the woman before me said, if you have everyone show up sick at the same time, you can't handle that. And Belmont's done an excellent job of keeping it contained to one unit for a lengthy period of time, which allows that unit to be in recovery. And now, yes, it's going to other places, but it's not all happening at once. That's about the staff doing the right things every day. We can't stop it. It's open living. There is no real social distancing. We've got people 6 feet apart now, but that's not adequate when you live there all day, every day, right? So if it wasn't for the efforts of that staff and the teamwork of that staff, everyone would have had COVID at the same time, and it would have overwhelmed the community, and that's not what has happened. We really will continue to fight every day, but just understand that a prison system is not a place when it's open bay living where you can keep COVID out for any length of time, and it's not a place where it's not going to spread. So we have to deal with that as best we can every day, and that's what we're doing.
Director, I may have missed it, but did you mention at Belmont what you're doing in regard to the testing and also PPE for the staff?
Yes, regarding testing, there's been several evolutions of that in the department across the time we've had the pandemic. At this point, though, they're going to be using a local hospital, and they just call and make an appointment, and they can be tested whether or not they have symptoms. Also, I know that there's...
Right, that's for the
employees.
Yeah.
Yes. And then for, as I stated, for the people that live there, we follow the testing plan I described earlier. Then your other question was about what?
PPE.
Okay, so PPE, yes. Now we have enough surgical masks on hand to give a mask for every shift to every person who works inside the prison. And of course, the people that live in the prison have 4 cloth masks that they rotate and clean, and then we replace because they're only good for 15 washes. I think that the problem with PPE, and the reason you hear so much about it, is because not everyone agrees on what type of PPE should be used under what circumstance. And we follow CDC guidelines in a department. I feel it's important to have some kind of authority, give us guidelines that tell us what to do when, because everyone has an opinion about what ought to be happening. And I think we should use the expert's opinion and make sure that we implement it across the board faithfully. That's probably the best that we can do at this point.
Director, thanks for the report. We'll have you back in a couple more weeks. We appreciate it.